my father was a refugee, if you want to know. He was born in near Afghanistan and then border of Pakistan, and today's Pakistan. At that time, it was just one big mountainous area. And he had proactive thinking in his mind, realizing the war was happening, and so he decided to leave the country. He was only 18 years old, and his wife was 14 years old, very young, and so he left the country and went to Malaysia. As a matter of fact, a lot of people died during the wartime, and lucky for him that I was born in Malaysia. That's where he went to. And those are things that you have to see, proactive thinking from your parents. And he decided that he had to find some sort of a job to continue living. And so he began living in a dormitory, a long kind of a house, like your university setting here, little corners, families were put together. And so he began to think progressively in his mind that he wanted to go into business. That's what he did. And lucky for him, he was successful. He was one of the very early people who felt that the Japanese had occupied Malaysia at that time. The war was on, and which means that you had to learn how to survive. And so he had proactive thinking in his mind that he would do business such that he would go to people's home and sell them things, and he became very, very successful. So people could not travel easily and go shopping and buying things for themselves because it was difficult. So he did that, and he became very well known and became a very successful businessman. And he had 6 children. I'm the last one of the 6, by the way, so I'm a baby in the family. And my third brother was my mentor. He was decided that he was going to go into medicine. And so he went to medicine, he graduated and came back, and I was always watching him and told him, can I go on rounds with you one day? And so he took me one day, and I told myself, I want to be like him. So he was my mentor. So that was my first step to mentorship. So when he took me around, I felt it feels good to treat people. You get something back from someone who was feeling well. And I looked at the books he had in the room and said, oh my God, I can't figure this out. I don't think I can do this. But in my mind, I felt I want to do this. So that's the first step to thinking process, that you had a will, you had to find a way. So you decide to do that. Over time, I went on carrying on doing that. So I got into med school. I did medicine. I graduated. I'm not going to go through every little detail, but after graduating, I came back to Malaysia to work. And unfortunately, at that time, the country was in a little civil war, and I was a young physician who was drafted in the armed forces. So I was a captain in the army, trained less than 1.5 months to learn how to shoot and carry guns. That's me at 26 years old. So we were going in helicopters and helping, looking after your soldiers or things like that. And you see that? At that particular time, I told myself I was working in a hospital, and I was told to look after a gentleman. And that gentleman, if you see in the back, was Norm Merkley. He was a plastic surgeon, and I'd never done plastic surgery in my past. So I was asked to work with him. So he was my leading mentor, who was responsible for me coming to Canada to do plastic surgery, because I loved what he did, and I told him, I want to be like you. So we had communications, and I had the will. He helped me he showed me the way, and I applied for the university and applied for so they took me on what you call probation kind of a thing for the first year. From Malaysia to here, it's about 21 hours to get to Vancouver. It's a long ways. Different culture, different lifestyle. So many of you come from different places. I'm sure you know what I'm talking about. So I give credit to him for being my teacher, my mentor, to let me proceed in life, what to do. So I decided to do plastic surgery, and the education process, as you can see, is residency and post-residency planning, post-education, and my surgical practice. During the course of your residency, you meet people. I met a colleague of mine. He says, hey, why don't we do the American board exams? I said, what for? I'm a Canadian, I'm going to practice here. You never know. Sure enough, I listened to him, and so we both did the exams. He's in the States right now, and I did my American board exams and graduated with that too, so I got licensed in both countries. And aspects of surgery, there were issues in terms of doing plastic surgery reconstructive, aesthetic, and research involvement. Those are the components we like to add on in all aspects. And I began to think in my mind, medicine alone is not good enough. We need other avenues. So music, sports, reading, community involvement began to be a big picture in my life. And just to share with you, he was my teacher in plastic surgery in UBC. You always have to go back and remember and contact the people that have been involved in your life. He was 91 years old, and I went to say hello to him in his house. He was talking about the Vietnam War, where he was involved in the work. That 2 weeks later, he died. So he was 91 years old. He was my teacher, and I had to say hello to him. So the mentorship was still there, and just making you aware that you have to go back and say thank you to somebody who was involved in your life. For example, another story, Bill Clinton, many of you know he was the president before. When he was very young, at the age of 13 or 14, he went all the way down to Louisiana, and he loved jazz music. And so he was standing outside the building, and they wouldn't let him in because he was too young. And the person who was playing jazz at the back room I've forgotten his name. He came outside and brought Clinton and made him sit in the front seat. So he was able to play. He listened to it, and then things went away. Forgot all about it. And Bill Clinton, after so many years later, invited him to the White House to say hello to him when he was still there. Just making you aware that there are things that happen, and you have to remember to be able to acknowledge people who have been in your life. Because they are picture players with you. That's just a picture. I decided that through my connections, I wanted to be involved nationally. So I was involved in presenting papers and things like that with the National Society in Plastic Surgery, doing some sort of research work, etc. And I also was involved because another gentleman from Toronto said, "Hey, Kim, why don't you get involved with the society?" And so I became secretary of the National Society, and subsequently organized conferences in Vancouver. And so you become proactive in wanting to do things like that in life. So, and then became president of the Canadian Society of Plastic Surgeons, because that was a position that they honor you and get on over time period. And so here again, involving the aspects, I began to consider in my mind that I wanted to go further beyond my level of just being a president only. I decided to run conferences across. We had a big conference with American and Canadian plastic surgeons in Canada. It was in Whistler, and that was very successful as well, so I was involved with that as well. And getting thank you letters from the president of the American Society of Plastic Surgeons. So we building a bond with American groups and Canadian groups, because the specialty is universal all over the world, things that we do. And one day I was in New York sitting with a colleague of mine. He says, "Hey, why don't you be involved with the exams of the Royal College?" And so he said, "We have to write written questions for the exams. It's a lot of work." I says, "Okay." So we got involved with that. So for 3 or 4 years, I was involved writing exam questions for residents who are going to qualify to be plastic surgeons in Canada. That's a tough job, and then become oral exams as well. So that was another avenue through which, like I said, you meet someone in your life that feels that you can do that, and you said, "Yes, I can." This is my team in my office, and without them, I don't think I can get anywhere, because they tell me exactly what to do every day. And research aspects, I've been involved with the 3D imaging, you might be aware of in breast surgery or facial surgery, whatever. Liposuction procedures, body contouring, cool sculpting. You might have already seen it on the internet and places where they talk about cool sculpting, where you can freeze fat cells and destroy them without surgery. Interesting concepts. And scholar surgery, just to writing publications and articles, and just an example to show you what a facelift can look like, and articles that have been published in the newspaper of research work that you have done over time. This was in the province about, 10, 11 years ago. And again, and these people are people who are involved with me in the research aspect. The gentleman in the center is from Italy. He's the very well-known person in the world who introduced ultrasound liposuction in the world. And the one on the right is the founder of the Aesthetic Society in Canada in plastic surgery. And so we were involved in this research stuff with them. And another newspaper article that talks about and research work done through UBC teaching people how to do liposuction. I'm going to go a little faster so you don't get bored and let you ask questions later. Like the American boards were involved with me and they asked me to be an examiner at the American board, so I spent about 10 years examining people licensing in the United States to be plastic surgeons. Something that I shouldn't say enjoyed, I really felt that I met so many people in my life that make you think and make changes for you. So this is an example of some of the work that we had to do with a child with a cleft lip, and just to give you an idea that if you do not know how the face is formed and all the parts are separated, so when you're born it's all put together into one. It's called central closure of the whole face, start from your forehead to the nose. So if you see some freaks of nature, it's just that the process of closure did not complete. So you'll end up with a lip or a nose, or sometimes you can see a cranial defect where the bone is not closed. Those children don't survive any. This is an example of how a palate closes. So you can see children have a nasal speech and they can't speak properly. Don't forget, these people are all normal in their mind. For example, like our Attorney General, Jeff Plant, I don't know who if you remember him or not. He was Attorney General of British Columbia and he had a cleft lip and a palate and repaired 8 times and very intelligent, went to Howard University, graduated and did very well. So these people are not handicapped. They all, good people. This is an example of a lip repair, and this is some of the team members that go with us. And this was an article in the Vancouver Sun about, because I got involved with this organization called Operation Rainbow Canada to do charity work around the world. And these gentlemen who are here doing these pictures are also volunteers who do exactly the same thing. They take pictures and put us on the website so people can see and they can support us and make things happen. And this was my first trip to Philippines about 21 years ago, so I've been doing this for over 19 years. Over 2,000 children have been treated, and you get certificates from different places having done the work. We live in a very healthy society here. You never have to sleep on the floor, but that's very normal to sleep on the floor. They don't have any beds. Children sleep on the floor. As a matter of fact, when we go in there, we take our shoes off because that's the bed. We respect their privacy. So you learn to adopt their culture and take care of the issues that land up. So all these things don't happen. We have to do fundraising, and Bill Vandesam, if you remember, was one of our supporters to help raise funds for us. And so we have had 21 residents in plastic surgery who have been on missions, and they've been mentoring our specialty. And Patrick Chan, I just use his name because he's from Australia, and he's come with us five years in a row from Australia to Cambodia to learn how to do cleft lip and palate surgery, and gone back to Australia, and it's in the specialty. He even helped raise money like $10,000 from Australia for Operation Rainbow Canada. This is in Mexico, where we did work down there for 5 years. Actually, Ben, my son at the back, he's there. He wanted to listen to what I had to say, and he was one of the photographers down in Mexico taking pictures for us. So this was in India, where we worked five years in a row. We went down and treated children from the Himalayas down all the way to Agra, the Taj Mahal. We just saw this is after the mission, not the time when we were working. When we finished surgery, we come back and participate in the local event to learn their culture, etc. And some of the methods of fundraising that we have done and articles that have been written, and a letter from my children to make sure that I come home safely, and some of the work that we've done in China. China, very interesting country. They think they have it all, but it's sad to see that there are a lot of children that are not serviced properly. We went to the central part of China called Lingyi City, which is war-torn by, they had a lot of war in that central part of China at that time, and they've got friendly with the Russians, and I must say that they had a lot of children that needed help, so we were very pleased to help them out there. And furthermore, and to give you an idea of a cleft lip, this is in Cambodia. That's totally deformed. This child has got literally no future unless something is done, and I'm sure this child will be wonderful after you put them back together. He can go back to school, educate himself, and have a future in life. So we feel that if you've treated one child, and you never know, maybe end up being the president of the United States or president of Cambodia or whatever, They have the intelligence and IQ levels as much as any one of us does. It's just the will, the motivation that you have to get to your destination. And this is in Mexico. If you look at the gentleman, he had a cleft lip and his son had a cleft lip. We fixed them both. He had never had it operated. He's 81 years old.
In this country, it's a birth defect that is almost always reparable, allowing the child to live a normal, healthy life. But in poor nations, being born with a cleft lip or palate can sentence a child to years of serious health problems, not to mention scorn and ridicule. That's where a charitable program started by a New Westminster plastic surgeon comes in. Linda Aylesworth spoke to his team after they returned from China and their 26th mission of mercy.
When Operation Rainbow arrived at Linyi City Hospital in China last month, it was to a hero's welcome. 25 medical professionals from Canada and the US had come at their own expense to help the poor. But the spectacle that awaited them, while appreciated, left them wondering if they had come to the right place.
It is like going to a huge auditorium and beautiful glass and beautiful building. Wow, they don't really need us.
But on meeting their young patients, it was clear their services were very much needed.
The very poor children come from behind little villages and they bring them over. They don't allow us to go there.
Operation Rainbow is a BC-based organization created by Dr. Rai 14 years ago that offers surgery to children with cleft lips and palates, deformities that affect their ability to eat and stay healthy, and later in life turn them into outcasts with little hope for a bright future. Without these altruistic surgeons, anesthesiologists, pediatricians, and nurses,
they wouldn't be done. They don't even fit into the program of treating them.
Over the next 14 days, Dr. Rai and the team will operate on 68 children.
If the baby is found to be healthy, then we will try and repair his lip.
While they're doing the preoperative assessments,
I have the infusion pump here.
others are checking out the recovery and operating rooms.
My monitor is all in Chinese. I'm just trying to work out what everything does.
They'll have to have it all figured out by the morning, because that's when the surgeries for children like Bo Peng will begin.
He had bilateral, you call it, both sides were open, and they called him a star child because he was always laughing and smiling.
You're a star baby.
Bo Peng isn't the only one who will benefit from today's operation. The Chinese doctors and nurses who attend will learn the latest surgical techniques.
We tried to push this down by putting a band across. Now it's more difficult because it's sticking out like this. Yeah.
Of course, the Operation Rainbow volunteers get something out of the mission as well.
I just have really appreciated the opportunity to come and just everybody's help and just making me feel welcome. It's been a fantastic trip.
Since its inception, Operation Rainbow, which is entirely supported by donations, has helped 2,000 children escape an otherwise dismal future.
Unsuccessful person in life, unable to go to school because everybody will be laughing at him, and he might be a very depressed child, maybe in a circus for people to look at. He looks good and healthy.
But that will not be Bo Peng's fate. Our little star baby now has a chance to achieve whatever he wants in life.
Just an example of fundraising, just to give you an idea what a mission is like, so you realize that you have to work really, really hard to get things going. This is when I received the award for, they call it Heroes of Asia because I've been to Asia many times. So this was in Vancouver, and it was one of the MLAs of Vancouver who happened to be there. There were other recipients. They were doing work in Burma, and then the other lady was a teacher, did some work in Thailand. So we were the 4 recipients receiving Heroes of Asia, and this was my invitation to go to the Governor General's Award in Canada, which was in June of this year. And not only that, going up glaciers and looking up the end of the world. This is up on top in Alaska, and I always remember that. It was interesting to know you have a stick there just in case there are a lot of crevasses that you can fall inside, so it was very interesting to do that. And I love skiing, and this is in Whistler. And any questions you have, I hope it's not too long, so any questions you have, I try and answer them for you. I hope I helped you to understand where you want to be, what your future is going to be, where you want to consider. Medicine is so vast in its specialty. You can pick any area that you like. But if you're going to pick something, make sure that you want to be the best. And with the knowledge will give you the strength to achieve your goal, and you have the will to want to do it. And you want to do it not because you want to do it, you want to do 1% better than the next person, then you're a star. Okay? Thank you for letting me speak to you guys. And if any questions, I'll try and answer them. So, yes?
So you mentioned about your non-medical or profit medical organization, Operation Level Canada. I was just wondering, did you face any challenges while trying to set this up and continuing this across different countries?
Yeah, there are a lot of challenges to set up going to different countries in the world. You have some countries don't want you to come in because they feel their own doctors are being embarrassed or they're not making money, and you're using their operating room, which will cost them money. So some places we go, we agree to pay some money for blood tests and all that. And if you give a blood transfusion, we pay for the child. Sometimes the child isn't doing well, has to go into a hospital, so we pay for the services of the child operation. Because the difference in Asia is not very expensive. To put a child into a hospital may cost $100 to keep a child in the ICU, whereas in North America it's like $2,000 or $3,000 a day. That's how different it is. And some countries that don't really want you there, so they want licensing issues. You have to buy a license from their country and they charge you a fee for that. China is very difficult to get in, but once you get in, it's very, very good. They're very formal and they love your help. Unfortunately, the politicians change very regularly, so every year you have to reapply if you want to go there. It's very difficult. India is another country that's very difficult to get into because they think that they're not a third world country. And so we have to apply for licenses and pay almost $100 a child if you want to operate in that country, although you're doing free surgeries. It's very funny. Whereas other countries like Cambodia, Thailand, and up north in the Himalayas, I've been to the Himalayas too, they don't mind you coming there and helping their children. It wouldn't cost you anything to do that. They love to have their children taken care of. So I think you're right, it's difficult, a lot of licensing issues. Good question, thank you. Yeah. Yes?
This is a subjective question, but recently I watched a documentary about plastic surgery in Korea. It was talking about how 1 in 5 girls in Korea does plastic surgery. As a plastic surgeon, I was wondering what your opinion of it was.
It depends on what they're having done, but don't forget in Taiwan, it's considered to be an elevated society. In Korea up north, I had a Korean plastic surgeon who came and worked with me in Vancouver for about 2 months to learn cosmetic surgery, and he's very busy down there doing very well. And it's the culture of the Western culture that's gone across the rest of the world now with the internet. Everybody knows everything. They want to look as best as they can, so that's why they do attract themselves to having some aspects of aesthetic surgery. Maybe the eyelid procedure to do a double eyelid operation, or some fillers in the lips to plump them up so that they're better. If you really look at it, it's called, I don't know whether you're aware, it's called a golden ratio. If you haven't, you can look it up in the, so everybody wants to have the golden ratio 0.6 to 1.168. So today's world, I see a lot of people who come in and they want to fit within that category. So people like Natalie Portman, Holly Berry, Angela Jolie, Aisha Rai, not related to me, one more, Hermosa, she's Japanese. All of them have the same ratios. So all beautiful people have the same ratios, 0.6 to 1.168. And all beautiful things in the world have the same ratio, 0.6 to 1.168. So I use that ratio to modulate the appearance of a person's face and build up where it's missing. So a butterfly has the same ratio. The tiger's face has the same ratio. Your Apple symbol has the same ratio. If you like cars, the Aston Martin has the same ratio. So what I meant is that these people have been smart enough to understand that if you look at, how long does it take you to tell a person is beautiful and not beautiful? Take a guess. How long does it take? Oh, that's pretty and that's not pretty. How long does it take you? How long? 1 second? 0.5 seconds, less 0.3 seconds. 2 minutes. I didn't bring any of those pictures because we weren't talking about it. Just to show you, you can put it up and you can, and just like that, you can tell that's pretty and that's not pretty. So when you have the golden ratio built in anybody's face, they can improve from that level to come to a different level. I hope I answered your question. So, yes?
Thank you for your presentation. I was wondering, it sounds like you're a very busy man with a lot of involvement with different organizations. How do you partition your time between your clinic and seeing your patients there, and also your missions, and also your involvement with like the boards and that kind of thing?
It's a difficult job. I mean, as a matter of fact, I'm guilty. My family thinks I do too much of other things. And they are concerned about me, thinking I'm getting older, that I should take care of myself a little better. Yes, you have to categorize in your mind, you prioritize what you really want to do, and that's how I do it. And I've stopped doing reconstructive surgery. I'm concentrating only on aesthetic surgery because I love that kind of work. I like maybe making people look beautiful, so I'm concentrating on that. And so I've given up doing emergency calls, so I've adjusted my lifestyle that way. And family, I always am excited to see my kids when they come and say hello to me. I'm very pleased to see my son came in today to see me. I meet him whenever I can, and it's good to know that he's come to hear me, because he may not know half the story I'm telling you. I won't be surprised. And so it's true, it's a difficult issue, and your spouses complain a little bit because you're not there. When they're talking, your mind is somewhere else. It's not good. But you're right, you've got to prioritize and decide to know what is important to you to do that, and give up certain things. Yes?
Since you have mentioned how you have been inspired to be a surgeon since young, I was wondering, how has your ideal of being a plastic surgeon perhaps when you're in medical school changed, like for you now?
I didn't understand your question.
As in, like, how has your ideals of being a plastic surgeon changed throughout the years?
My ideals were, when I saw this Dr. Norm Merkley operate, I already made up my mind, I'm going to be a plastic surgeon at that particular time if I can. Because I had the will in my mind, I had focus, I worked really, really hard. You get calluses sitting on the seat to graduate to be first a physician and then a plastic surgeon. I did the best I could. And because you're focused, you want to do it, you can do it, not that you cannot. And that's something I cannot share with you, because you will have it inside you what you can and cannot do. And over time, someone will tell you, hey, you got a good pair of hands. I was going to be a cardiologist, by the way, that'll let you know. And when I was operating one day, and this surgeon was working with me, he says, you have a good pair of hands. I worked with him, and I began to think in my mind, what he meant, not that the hands look good, it's just that technically when you're operating, I was assisting him, and he felt that you're the intuitive. So I still love operating and making people look better. We have Ben at the back. He's a very big supporter of Operation Rainbow, and he's in med school. You can ask him questions about medicine, and he wants to be a plastic surgeon because he believes in what we do. So, other questions? Yes, sorry.
You mentioned you were part of the examination process for surgeons. I was just wondering if you could give us more details about the certification process around towards the end of residency.
The certification process, when you finish your residency, is you go into practice. But while you're training in residency, you do nowadays it's changed a bit. When I did it, it was you had to be a doctor first and then spend 5 years in residency. Now they've shortened it. The residency program is much shorter. You can directly, from day one, select after your second year or third year to go into a specialty if you want to. So the newly graduated people have a lot of educated knowledge, but practical and clinical knowledge is limited. So when they write the exams, they have to do the theory part, and then they have an oral part. In Canada, the exam's a little different. You do your theory part. If you don't pass your theory part, you don't go to the oral examination. Whereas in the United States, it's very different. You do your theory and your orals after you have you don't have to be a certified plastic surgeon yet, but you go into practice after finishing your training, and you have to have clinical cases that you have done that have to be examined by the examiners in the United States, a little different from Canada. So to answer your question, after you finish your exams, you have to write an exam and then go to the orals, and the orals are very specifically different. They have about 4-8. You go to different stations and you have 2 examiners, but 8 examiners by the time you're through, so that you get a fair exam. As a matter of fact, what is interesting is the examiner who is examining you is also examining by an independent evaluator to make sure you give a fair exam.
And also, are the lengths of residency different for each type of surgery? Because I'm interested in becoming an orthopedic surgeon, but I'm not too sure, like, within surgery itself, would the residency lengths be different?
Each residency program is designated appropriately, so if you're going to go to orthopedics, your best option would be to assess the program that is offered by UBC, and then you would know how many years it is. And plastic surgery is also a little different, and medicine will be different, and they're all different categories. They're changing all the time because they feel that they were trying to get the doctors to graduate a little faster than they were in my time. My time, we did 5 years after you finish medicine. Here you're in the third year. I mean, Ben, you would know better since you're there. He can explain that to you better because he's already in medicine now, so he's making you aware. Yes?
It's my understanding that each specialty kind of has a personality. So what kind of personality do you think would be well suited for this specialty?
Plastic surgery?
Yes.
Somebody who's innovative, somebody who thinks beyond his scope. You can go to the same spot all the time, like very convenient you're very comfortable with the UBC, going to the place you go daily. Maybe one day go another way. Just go around, instead of turning right, turn left, and realize everything is different and it takes you a while to learn. If you're not prepared to do that, then plastic surgery is not for you. Because plastic surgery is changing all the time, constantly. Like, I've been in practice 30 years and I'm still doing things that are new. New in the sense that you have to upgrade yourself all the time to see what you can achieve. You can touch your nose this way, or you can touch your nose that way, but you need to find an alternate way to have an open mind. If you're fixated and very strong-minded that even things will not change, then you should pick things like gynecology or other fields that are very fixed focus, where you're constantly doing the same thing all the time. So you have to know plastic surgery is very evolving all the time. Now they're talking about stem cells. I mean, I don't know whether you're aware of stem cells. They're infusing stem cells into people and making them heal better, like trying to maybe stimulate your, trying to treat diabetes issues with stem cell transfers, even plastic surgery, getting stem cells to harvest fat in your body to improve the appearance of your breast, and using. So there are a lot of things that are happening that are new, and it's always a learning process. So. Well, good questions, yes?
Since you've been in practice for so long and medicine has always been such an important part of basically your whole life, looking back retrospectively, is there anything that you regret at all?
I regret not spending enough time with my children when they were younger. That's my big regret, and I'm happy that I'm working at it now. I have no regrets in what I did. I love my job. I still love it. I wish I could carry on forever because every day I'm learning something new. Maybe I'm a little different, but I like to be in the best I can do. And what other regret can I have? Let me think. I don't miss leaving Malaysia. Although I regret not being able to go back and have the cuisine down there, which is amazing. Really, I mean, it's a blend of Indian, Chinese, and Dutch. Have you ever eaten any Malaysian food? If you haven't, you go there, you will never come back. Well, I hope I've seen. Yes?
One last question. What was a very memorable clinical experience for you?
Clinical experience?
Yeah, what was a very memorable one that stood out?
The most memorable one was, of course, when my children were born. Number two is the most memorable first time when I was sitting in the plane and coming back after writing my I'd done my American boards and I did my Canadian boards, and I sat in the plane and wondering whether I passed or not. And so happened I was sitting with one of the examiners. You're not supposed to do that today. In those days, it was different. He says, "Why are you sulking? You starred. You're an ace." Says, I didn't believe him. So that was my memorable moment in my life, to know that I had passed my plastic surgery residency in the plane, so I didn't have to wait very long. But it's an exciting feeling to be able to achieve something, and the second most important thing is when you can do something that looks beautiful again. It's always wonderful to be able to achieve that.
What would you do differently in your medical career?
I wouldn't change my job. I love what I do. I spend a little more time with my kids. That's what I would do. Other than that, I still like my job. If you like your job, you never want to quit. So you have to find something you love, and if you love that, no matter how old you are, it doesn't matter. I'll still be talking plastic surgery even when I'm retired. So, yes.
Kind of not medically related, but have you ever went back to the part of to your dad's village, or where have you ever went back to where your parents were from?
I have been only as far as up to the Himalayas, and that's it. And never been to my parents' hometown. I've never been to Afghanistan. My father was born in Kabul, but he even could write the script, although he wasn't a Muslim. He was a Malaysian, and he became Malaysian at that time. And it's interesting, when I go up the Himalayas, from the name Rai, they said, "You're connected to so and so and so and so," and I said, "I have no idea who they are," because they have, if you go to all this, even in China, when you go, they have all clans and different family names, and they're connected, and they'll say, "Oh, you're connected to the Tang family," for example. "Oh, you're connected to that family, so you must be related somehow." So you went through a lot of Rais and way up north, and different and interesting to see. Actually, it was interesting. I met my uncle, my mother's brother, many, many years ago. I didn't believe he was my mother's brother because he was blonde and blue-eyed. So I was figuring out how could that happen, and then I looked into history and realized Alexander the Great had come up north and been in northern India, and he went back, but he left his soldiers down there, and they're interrelated with relationships. So all the very northern people are very light and blue-eyed, light-skinned, light-colored people living up there. So because they spent 7 to 8 years down there, so just interesting world. So, yes.
Have you done any major facial reconstruction procedures on someone who was heavily injured, say military personnel through combat? And how did the difficulty of the procedure compare to in a more relaxed setting, say the children?
Yes, we have done a lot of car accidents. I work in the Royal Columbian Hospital in the past, and a lot of car accidents. As a matter of fact, if you take a pumpkin and you drop it on the ground, it explodes, right? The face does exactly the same thing, exploded, and you've got to put the pieces back together. So the important thing is to put the skeletal system back the best you can, and then the soft tissue is brought as best as you can. It may not be one operation, you may need to do multiple procedures to get him into a more acceptable position. So there are lots of procedures that you would have to do to achieve that. Yes, we have done, I used to do a lot of that in the early part, taking pieces of bone from the skull and building up the eye, and we could chip pieces of bone. The brain has two tables, outer table and an inner table. You can chip off the outer table and reconstruct portions of the face. The inner table is protecting your brain, so you can take some of that off. It's a technique that you do to achieve that. So yes, you can.
The reconstruction part, would that be immediately after the accident, or do they try to save the person's life first before?
Yeah, of course. Your patient has to be stable. The anesthesiologist has to be happy. And initially, it's like putting things together properly, and then you may have decided you got the skin all covered, now he's healthy, he's better. I would take him back and reconstruct him within 7 days rather than immediately on the same day. But in the same day, if the wound is open, you have to close all that up and then take him back within 7 days to plan, do a CT scan and see exactly where the bones are and try and match them back together. Yeah, you stage it sometimes, yeah. Done lots of that over the years, yeah. Well, it's unfortunately our give you an example. About 25 years ago, I used to cycle from Richmond to Vancouver General Hospital where I was training. There were no cars on the road. I could cycle all the way Cambie Street all the way down to VGH and then cycle home. You can't do that today. You'll be killed, I think, because there's so many cars going every direction. So just making you aware the population larger, so car accidents are more severe. Injuries are very, very pathetic when you see, especially when now motorcycles are on the road. One interesting story, we had Royal Columbian Hospital, we had 3 motorcycle accidents about 10 years ago, and body parts were all missing. Didn't know what belonged to whom. It was quite amazing sometimes, but it's scary. Drive slowly, be careful. So, yes?
Out of curiosity, how many hours do you usually a week on average throughout your career? How many hours do you usually work a week?
I work all the time, really. And we see, I'm constantly working in my head, but physically, like this morning, I got up at 6, and because between 6 to 7 you can think a little bit, and then had my coffee, that's about it. I did surgery this morning until 2 o'clock, and then I'm here. So normally my day is about 8 hours, 9 hours sometimes. I take Friday, Saturday, Sundays off now, and when I was at your age category, I was working longer, because you're trying to make a living too besides operating. So I've cut down my services to 4 days a week if I can. But the days are longer, that's all. Yes?
So what do you enjoy doing in your free time?
My free time? I like cycling a bit. I like to go hiking. Jason is I like to go with him. He's a good hiker, make sure I can make it. I ski a lot. I do a lot of skiing in the winter. And I go walking on Saturday morning if I'm not going anywhere. Listen. I like classical music. I love music. So makes you feel good, relaxes your mind. So I didn't know how to use those things, but now I can. So yes.
So with all these recent advances in the field, you can do personalized 3D printing for reconstruction stuff. What technique are you most excited about that's up and coming?
I think up and coming, the 3D imaging is good. As a matter of fact, today we come to a stage where you can, because of computers, you can teach technology overseas to, for example, during the wartime, when there were surgeons that didn't know how to fix something, they were able to take the photographs and send them back, and you could advise them how to proceed with the operation down there to save the person's life. So technology is has very advanced a lot. I can show you pictures of, 3D imaging on breast is amazing. The person can look at themselves exactly what they possibly will look like if they had surgery, which they hadn't had the opportunity before. Similarly, the face, you can do the nose and the facial parts too. But in medicine for you, you can learn basically now how to do the surgery by connecting with the 3D imaging process, exactly how the 3 planes are and how deep you're going, and you can literally do the procedure with the specialist surgeon to allow you to do that and learn how to do it. So it's much, but we never had that. We went to the anatomical dissection. We don't have them here, but where I trained, we were dissecting dead bodies, real. You were doing anatomical dissection in your anatomy classes. Now they have all dissected portions, and you can learn by feeling them. They didn't want to spread any infection or disease, and they didn't think of that in those days. Now it's well. So advances have happened a lot for benefit of students. Yeah. Yes.
What's kept you motivated to go above and beyond what a lot of other physicians would do? You're an active member of American and Canadian College of Physicians, and you do overseas operations for free, and you do practice, and you then research as well. So what's kept you motivated to do all that extra stuff, I guess you could say, throughout your career?
Well, you have to feel you want to do it. It's left to you. Some people are very happy. Just to give an example, I was working in Malaysia. I had a good job. I had a maid cleaning up the house. My car, I had a chauffeur. I didn't have to pay tax because I was in the army for a while. Food was cheap. I had plenty of money. I wasn't happy. So you have to know what makes you happy. I decided that I want to go one step further. An opportunity came in, and there was a visiting surgeon coming from Canada, and nobody wanted to work with him. They all were busy. They said, well, I said, okay, I'll work with him. I worked with him for a week, and that changed my life. So I haven't given up that because he did that. I feel that just like the Haida people, if you remember, they were very educated, they were very good with their hands. Because they had food and they had the availability of resources, they were able to go fish. They didn't have to work very hard. So the art became the big issues. They began to make amazing art. And whereas many other people in the native culture had to work hard to make a living, so they didn't have time to go into artistry and other things. Similarly, this is the same thing. Since I've done well, I felt in my mind that I wanted to help people in the third world country, and decided that I was invited. I didn't do it on my own. I one day went with the American group and felt very touched to see all these children who were being, so sad to see them so bad. And I felt, why not I start this in Canada? And that's how we got started. And I feel very proud that we're great supporters here who have come all the time helping us to do the work, and team members that are from Canada and US who have participated in our organization. So you guys have a lot of questions, so I appreciate it. Well, I hope I've stimulated you, and hopefully you'll have I'm sure you'll have something in your head that'll happen. I always remember one student I gave in high school about 20 years ago. It was very interesting. I was just talking to a high school person, and I forgot all about it. I was talking about future medicine, and she came back about 10 years later and sent me a note saying that, Dr. Rai, I want to thank you for giving the presentation, and I'm now a plastic surgeon. So I thought, wow, I said, that was great. Nice to know that someone had followed my footsteps through talking only, so that was good. Okay, well, thank you guys, and appreciate it. I hope you all the best to you in your careers.
On behalf of the fraternity, I would like to give Dr. Rai a small token of appreciation for coming all the way here.
Thank you. Thank you very much.
Guys.